This video is one of a series of personal support worker videos that demonstrate the skills needed for the role of the support worker. It is understood that there are multiple ways to carry out these specific demonstrations. The premise of these videos were that we would use skills that are safe, ethical, and also include best practices. We hope you enjoy and, of course, learn something. Moving a client in bed. This procedure is used to move a client to the side of the bed. Situations where this may be necessary include, but are not limited to, moving the client in preparation to sit up and dangle legs at the side of the bed, moving the client in preparation of repositioning him or her into a side-lying or lateral position, and lastly, moving the client in preparation for a transfer out of the bed. Pre-procedure. Always check the client's care plan before beginning any procedure. Look for special instructions. Check for the description of the client's abilities and limitations. Perform hand hygiene before entering the client's room. Knock on the door and greet the client. Identify client according to agency policies. Explain the reason for you being there. Provide privacy. This can be done by either closing the room door and/or drawing the curtains. Provide hand hygiene. Ensure the bed brakes are on. Raise the bed to your waist level, and when appropriate, lower the bed rails to provide care. Fan fold top linens to the foot of the bed. Explain the procedure to the client as you proceed. Remember, if the client is larger than you, it is not safe to move him or her alone. Get assistance. Stand near the client's waist. Stand with a broad base of support to prevent you from losing your balance while performing this procedure. Stand with your feet about 30 centimeters or 12 inches apart and 1 foot in front of the other. Flex your knees. If client is able, cross the client's arms over the chest. Place your arm under the client's neck and shoulders and place your other arm under the middle of the client's back. Move the client's upper body towards the edge of the bed. Next, place one arm under the client's waist and one under the thighs. Move the client's middle body towards the edge of the bed. Place one arm under the client's thighs, other arm under the calves. Move the client's lower body towards the edge of the bed. Remember, the bed level is high and railings are down, so stay close to the side of the bed. Place a towel or disposable pad underneath the client's feet. This will protect linen from getting soiled. Help the client to apply shoes or slippers if they are unable. Remember, have shoes and slippers close by so you do not need to leave the client's side. Perform hand hygiene. Lower the bed rail and raise the head of the bed slightly. Position the client in a side-lying position facing you. Slide your arm under the client's neck and shoulder. Place your other arm near the knees and grasp under the thighs, pulling the client's feet over the edge of the bed. Ask the client to hold on to the edge of the mattress. Help the client sit upright. Do not pull the client too close to the edge of the bed. Only the client's knees should be at the edge, not the thighs or buttocks. Ask the client if they are dizzy before proceeding. The overbed table is put in place to provide support and the client's book returned. The call bell is provided to the client and the disposable blue pad discarded before leaving the room. In this segment of the demonstration, the client was moved to the bedside in preparation for her breakfast tray to arrive. In this next segment, transferring a client from bed to wheelchair will be demonstrated. For the purpose of this video, we are continuing where we left off with the client at the bedside. Transferring a client from the bed to wheelchair. The procedure of transferring a client from their bed can be applied to several situations. Transferring to a commode, transferring to a chair at the bedside, or transferring to a wheelchair, which will be demonstrated next. Equipment and supplies needed: wheelchair, incontinent pad, hand sanitizer, disposable blue pad, blanket, and non-skid shoes. When entering the room, bring the wheelchair, blue pad, and blanket. Provide privacy. Identify client according to agency policies. Ensure bed brakes are on. Before helping the client to stand up, ask if they feel up to the transfer and if they are able to assist. Place the back of the wheelchair aligned with the headboard or the foot of the bed. Remember, if client is weak on one side, put the wheelchair on the strong side. Ensure client is wearing non-skid slippers or shoes. Lock the wheelchair wheels, raise footrests, or swing them out of the way as needed. Lower the bed to the lowest position if not already done. Stand in front of the client with your feet apart. Have the client hold onto the mattress. Align your knees with the client's knees. Place your feet in front of the client's feet. Place your hands under the client's arms and around to the client's shoulder blades, and to stand on the count of 3. Continue to block the client's feet and knees and keep your hands around the person's shoulder blades. Pivot on your foot and turn the client so that he or she can grasp the far arm of the chair. Continue to turn the client until the client grasps the other armrest. Lower the client into the chair as you bend your hips and knees. Position the client in good alignment. Position the client's feet on the wheelchair footrests. Cover the client's lap and legs with a blanket. Make sure to keep the blanket off the floor and the wheels. Provide client with the call bell before leaving the room. After all procedures are completed, ensure that you do proper hand hygiene. Ensure also that the client is safe and comfortable by putting the following safety measures in place: lowering the level of the bed, make sure that the bed rails are up, and providing the client with the call bell. In addition, ensure that all of the privacy measures have been removed. Clean and return equipment to the appropriate places. And lastly, document the care that you have provided, how the client tolerated it, and any observations that you have made.